Can you hear me? What's that? Is that courthouse maintenance hand raised? I did.
Check, 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 check. Check one, check two, check three.
Okay, good evening, everybody, or good afternoon. Today is Monday, July 31st, 2023. The time is 4:32, and welcome to our Justice Financial Advisory Committee, also known as JFAC. I'd like to go ahead and call this meeting to order. So we have lots to discuss, and I understand that there is lots of things that are happening, especially an event that's happening during our meeting. And so some of our attendees and some of the folks here in the audience will probably want to go for reproductive rally rights. But of course, our meeting is also very much important as well. So we will handle, especially this particular topic. So we will just go ahead and get started, and those that have to leave can excuse themselves. But we will get through our presentation here. So for my JFAC committee members, I would like to call for an adoption of our agenda.
I move that we adopt the agenda.
Second.
All right, all those in favor say aye.
Aye.
All right, thank you. Next, we move on to the recap of discussion on Intercept 5 that we had a couple of weeks ago, which was a really robust conversation. Thanks again to Ms. Mary Morgan for coming and having that conversation with us. And just to kind of go through my notes that we have here, maybe I should share screen as well. Give me one moment. Trying to share my screen here for people to see. All right. All right, can everybody see that okay? All right, so Intercept 5 were recommendations. Again, to briefly kind of go over and highlight what we see here. We talked about incentivizing landlords, risk mitigation fund to open up more units. That was definitely something that was majorly talked about. People to walk besides those who have been recently incarcerated, kind of like a peer system. Court mandated rehabilitation program, treatment and stabilize instead of being sent to jail. Gap in services from release to treatment, release and get appointment, but there was no follow-up. These are all things, again, that we discussed, but just kind of recapping here. But with Mary Morgan's presentation from Headed Home, she had talked about a rental task force that included Glick rentals, and we were talking about more space for housing, in particular those that are recently incarcerated and trying to be rehabilitated back into society. As we have discussed several times in meetings, especially that particular meeting that we had, there is a lack of housing for those who have a case, so to speak, and those who have a history. And so we were trying to have the conversation and have more discussion regarding that particular housing. And when we talk about the rental task force that included Glick rentals, that conversation was trying to get more people to take vouchers, like Section 8 vouchers, because there is a need for that. And one of the biggest things is Glick rentals. They're much into the community, and they are based out of Indianapolis, and just trying to get landlords together to actually take on vouchers. Again, housing voucher for those incarcerated, rapid rehousing and beacon fees, day reporting, and employer supports. So those were some of the highlights that we have here. Again, this can all be found on our agenda if you're at home for free or for further reference, along with the Intercept 5 suggested reading list. So with that being said, I just want to open it up to the committee members here. Did I miss anything, or is there anything else that should be discussed here?
I don't think so. I think this is a good recap of our conversation, and I think you did a good job compiling these. Thank you.
Mm-hmm. Okay. All right. All right. So again, as if you are new for the first time and following our meetings, we are going through different intercepts that our county council, which is the financial body of the county, have a responsibility for. And today's particular conversation that we are going to have is diversion. And so this is also supposed to be a makeup meeting of the one that we were supposed to have in June due to the storm that was canceled. So this has been a very hot topic. I have a presentation here that I will share, but I will also make it very brief because we have two other presentations that we want to have. Plus, I wanted to make sure that we have ample time for discussion after hearing those presentations, as well as hearing public comment as well. So I will go back to sharing my screen here and getting my little handy dandy presentation here. Trying. There. So again, this is intercept zero, which is also diversion. And the main topic again of this is what investments can county council make for community services to reduce the number of people entering our justice system? And a lot of the information that I looked at is all in the reading list. This was from the Eve Hill and Ken Ray report that were done a while back ago. So if anybody wants to go back and read those as I did, I find it very informative for this particular topic. So I would recommend doing so. So one of the biggest things that I think about is when we talk about diversion, I think we have to get to the root of the problem. We cannot. One of the 12 steps of trying to solve a problem is get into the root of it. And so I found this quote that was really interesting. And so it says, when solving problems, dig at the roots instead of hacking at the leaves. And I think that is really something that we're trying to do, whether it's unintentional. All of us are trying to find a solution to the problem, but we really have to get to the core root of what that particular problem is. So as I had mentioned before, what are the issue and concerns? And the Eve Hill report, it was composed of lots of groups and organizations, a lot of social service programs, Monroe County government. This was done a few years ago prior to the administration of the Marte Sheriff administration. And so there were lots of different things that were discussed. Lots of people were interviewed, and this is some of the things that were followed. Participants felt that our jail had shifted costs to inmates for various supplies, programming, medication, and it also disparately negatively affected inmates with mental illness and substance use disorder. And we also know in that report too, that 75 and 80% of our inmates housed in our jail have mental illness disorder or substance use disorder. Another thing is participants also identified that prejudice against and assumptions about, can't see my screen here, about individuals with SUD as well as systemic racism have led the public health and criminal justice system to emphasize criminalization and fail to prioritize treatment. Participants were also concerned that despite the growing evidence that mental illness and SUD are treatable health conditions and not character flaws or serious threats to public safety, the justice system continues to focus on punitive responses to these conditions. Next, our county has implicit structural barriers such as high market rents, limited public transportation, and limited employment options. And what was also found as well, and we've also talked about several times in various meetings here, is some of our groups and social service organizations work in silos. We all have the same goal. We all want to help all of our community members. We definitely want to make sure that folks don't have to go back and continue to go back into the system. However, it seems to be that certain groups and organizations, whether it is implicit or explicit, work in silos and not really together. So what can we do? And this is the conversation that brings us to now. We, again, County Council has a fiscal responsibility. And we have heard through various program or presentations and other conversations, whether we all have had conversations with individuals with programs or just in general, we know that in Monroe County and in Bloomington, that we have a desperate and dire need for more housing, more supportive housing. And supportive housing could be more of a single housing or a family unit, but that doesn't necessarily have to be tied to terms and conditions of treatment or a way of out of incarceration. Transitional housing, we heard that many different times, that we are trying to, as people are trying to come out and go back into the world here and in our community, they need help. They have to have that transitional housing. And emergency housing, we saw that with the COVID-19 pandemic, where we did not have that housing that was readily available, and how that is a desperate need and how that is definitely still a need now. And if you also notice here and very down at the bottom, as I was going through this, one of the things that was I was constantly reminded of and going through and preparing for this is, if we plan to fail, if we fail to plan, we plan to fail. And I thought that was very much important, because we all have a responsibility, whether that is county council, county commissioners, or other entities in the city of Bloomington, other stakeholders. We all are a part of this process. And if we fail to plan, then we plan to fail with the next steps as we think about a new facility. Supportive employment. We heard previously with Misty's presentation how she had mentioned that employers like Goodwill work with New Leaf New Life. We also know that we have a very busy and robust business community, such as the Bloomington Chamber of Commerce and the BEDC. I also have had conversations with some people and related to the Bloomington Chamber of Commerce and BEDC, and they also know that if they have businesses and employers that are needing employees. And we have people that are in our jail that are needing employment. And so how do we work those sectors together? And how do we bridge the gap where employees are meeting with employers, and we set that up where immediately coming out of this facility and coming out of jail, how do we set that up where you already have employment as soon as you get out? More supportive programs and services, family support groups. We also know that when a person is incarcerated, it does not just affect that particular individual that is behind bars, but it also affects everybody in that house. Moms, dads, sisters, brothers, most importantly, children. How do we get that support group? And from doing some research and digging, we do have some support groups that help families, but oftentimes a lot of people have said they can help more, they just need more funding. And you'll see funding here in just a moment. Peer support programs, kind of like a buddy system. How do we pair up those that are from current incarceration, that are getting ready to come out, and help them bridge the gap so that they aren't going back into the cycle of our criminal justice system? And rehabilitation services. We can fund those things. And it sounded like some of the services that we had stopped prior to COVID. And then we all know COVID just kind of changed the game for everything. But how can we do those things again, where we can have those health services, those programs to help people get back into that? And then lastly, other investment opportunities, investment in community groups and organizations. We have lots of various groups and organizations that are here that are really doing some good work. We heard from New Leaf New Life, and we'll hear from a couple of other ones here in just a moment. But how we fund our priorities, and I heard that quote a long time ago, and that still continues to resonate with me. And if these groups and organizations are helping, how can we do that? And the way that I think that we can do that and how county council can do that is to free up and have some allocation of funds here. So, and also the other one is involving other community stakeholders. As I mentioned before, again, Monroe County is responsible for the Justice Project, whatever that looks like. However, it is not just our problem ourselves, and we should not just be selfish enough to think that it is. And I don't definitely think that we are, but how do we get other stakeholders? And the stakeholders that are missing are IU Health. They can help out tremendously with that. How do we get them to come to the table? How does this benefit helping them with that? How do we also get other big employers like Cook and other employers to get into this? Also, as I look around at this table, I see, city colleagues here, whether they are here in person or via Zoom. How do we work together where we all have our own financial obligations, but we also have our own financial pot of money? How do we bring those together? And how do we make this a big project in which we can fund these social service groups and organizations so that they can help do the things to help less people go back in and cycle through our criminal justice system? And then I say funding right now. And what I mean by that is we and the county are going through with ARPA discussion. We have ARPA funding that is available. And of course, look at Commissioner Githens that's here and our county council that's here. How do we look at what is priority? How do we look at what is left with our ARPA funding? Because we have to spend down or have an idea of ARPA funding and what we plan to do by the end of 2024, and we have to spend it by 2026. We have that funding that is available right now. And so we also have our opioid settlement money. We also know that our city of Wilmington also has opioid settlement money. How can we take those pots of monies? And of course, with our opioid settlement money, we have restricted funds and unrestricted funds, and we have to be careful on how we do that. How can we turn that into that? One of the ways that I brainstormed and thought about is we could turn some of that money into grants where we can have people apply for that, especially New Leaf, New Life, Courage to Change, different types of organizations. Again, just brainstorming so we can have this conversation. But again, we have the funding that is available right now where we can do some of those things. So in conclusion, this was a quote that I saw in the report. I think it was on page 15. In short, in order to reduce jail overcrowding and unnecessary incarceration of its residents, Monroe County must prioritize alternatives to incarceration diversion for violation of court-imposed requirements, for substance use violations, for detox, and for mental illness-related offenses. To the extent people cannot be diverted from the criminal justice involvement, Monroe County must ensure that the jail operates as a pipeline into treatment, rather than releasing people to the never-ending revolving door of crisis, relapse, and recidivism that destroys lives, families, communities, and county budgets. So with that being said, I will stop sharing. And that is the end of my presentation. So again, we will have a chance to kind of dive into a lot more of that here in a moment. But most importantly, we have Linda Grove Paul from Centerstone and Marilyn Grimes from Courage to Change Sober Living that are both here. And both have presentations to talk to us about what they are doing in their ways of reducing recidivism and how we can further help them on the county council level as well. So each of them will have about 10 minutes for your presentation. And I will start first with what I see here on the agenda with Linda Grove Paul. Welcome.
Great. Peter, do we know if the presentation is? up or
Yes,
is it coming?
Courtney
Okay, great.
Mosier in her office has started
She's
your
got it.
presentation, so she'll run your slides for you.
All right, sounds great. Just so you know, my name's Linda Grove Paul. I'm the Vice President for Centerstone Adult and Family Services. And I have with me today Melissa Helm, and she's our Director of Crisis Services. 10 minutes is going to be quick, but this presentation will be available. There's a lot of data and information on here. And I just feel like there's a lot of people who don't have this information, so it's really important to cover. Stride, the Stride Coalition was formed about 5 years ago. And it really is 2017 crisis on Kirkwood. A whole bunch of concerned folks came together and said, yeah, we've got to do better, particularly around the opioid crisis. And what you see there are, all kinds of community agencies along with governmental agencies coming together and saying, what solution do we need to have in our community? Next slide, please. And basically what we came to was that, our biggest issue is not having a place for people to go. So if you look at, the fact that oftentimes people end up in jail or the hospital, or law enforcement just interacts with people in the community, oftentimes it may not be for any kind of serious criminal violation, but it is something where law enforcement has been called. And alternatively, they don't really have anything to do other than go and meet with that individual. And sometimes it might end up in arrest. Sometimes it might end up in that individual going to the hospital. But there really wasn't an alternative. We looked at a lot of programs. We looked very seriously at law enforcement assisted diversion. We kind of looked at programs throughout the country. And the issue still was, if we didn't have a place to take somebody when they were in crisis, we really weren't going to have any good solutions. So we basically came together and said, we need to come up with that place and space. Next slide, please. So, yeah, as you know, 911 really has been the only solution. And frankly, we're all hardwired to call 911 still. 988 is something that is available now. I'm going to talk about that a little bit more. But, the reality has been in Indiana, there has been zero funding for crisis services. That is a big part of the reason why we have found ourselves in the situation. Law enforcement, de facto social service, you get called to a situation, maybe somebody's having a psychotic break, they're throwing things everywhere, people have heard noise and they're not sure what to do with them. And because the situation is so escalated, something has to happen. So lack of on-demand resources, lack of place to go, lack of training to address the crisis. And I think that's training and the stigma of mental health and substance issues throughout the community. So much of the time, people just don't know what to do alternatively, and they don't have the training or the resources. And finally, lack of follow-up and connection, which is very much what Jennifer was talking about. Next slide, please. So what is the Stride Center? It's a safe place for people to go, regardless of whether they have mental health or substance, 24/7 for 18 and older, can stay up to 23 hours, accessed by anybody, anytime. We don't turn anyone away unless, we need to send them to the hospital medically, or there's some threat of violence on their part, but we have a no turn away policy, staffed by our crisis care staff and peers, focus on de-escalation, harm reduction, and care connection. Also in support with our mobile response team. We have a mobile crisis team now that's available. And much of this is new since Eve Hill did her report, 3 years ago. So almost all of this is new. Supported also by our rapid response treatment team, which I won't have time to talk about, but there's a slide on that in the presentation. And we accept all referrals and require no assessment. And again, that's big because that's part of the reason why there's no crisis infrastructure. Is the only way for a mental health provider to bill a client previous has been you have to do an intake. And if an intake is required, then that means lots of paperwork. It means asking lots of questions, getting lots of information. And if a person's in crisis, that is just not reality. Next slide, please. So basically, if you just look at, this is a picture of, kind of the Stride Center living room. We're right across the street from Showers Plaza at City Hall. And again, the purpose is to de-escalate, rest and detox. We have a lot of people who come in under the influence, not a problem. Worked very closely with prosecutor's office when we first started, and I think there were probably about a dozen charges where it said you can just automatically divert those individuals. And again, the purpose of Intercept Zero is to prevent people from actually having to come in contact with law enforcement. So if you have an alternative of a place to go, and again, with mobile crisis, you have somebody who can go out and meet with those individuals, it really is a way to prevent people from having to get into the system to begin with. Engaging with peer and crisis staff, assessing what they need and want. That's a really important part, because oftentimes we look at these individuals who are in crisis and we think they need treatment. Well, what if they don't want treatment, right? Oftentimes that may not be the case. And what you'll see with some of the data is a lot of the people who are coming to see us have lots of different problems. And when they come, the first thing they're really interested in is housing. I need a safe place to go. Food, employment. So you have to be very, very focused on what they're motivated about. And again, what we'll see with the data is people come back again and again because they get their needs met, and then they want to follow up. And oftentimes it's to address their mental health or substance some point later on. Connect with resources and care. That's huge. And you talked about the silos. We partner with anybody and everybody. We do so much in terms of getting people into, whether it's an acute care hospital, substance residential, person who overdosed. We actually had one over the weekend where that individual on a Friday wanted to get into substance residential, couldn't get in right away, could get in something middle of the night on Saturday morning, and we're able to provide transportation and get that person to that location immediately. So having that sort of on-demand resources, and again, working with a whole plethora of resources has been really amazing. So next slide. So I just want to talk a minute about 988. I think most have heard about 988. Obviously, it's the mental health and substance alternative to 911. SAMHSA, who is, kind of the feds, the federal government passed 988 legislation. It'll be 3 years this fall to say anybody should have access to a broad continuum of care. And that care should consist of 3 buckets. And this is something that, SAMHSA is not only saying at the federal level, it is expected at the state level, and Division of Mental Health and Addictions is working very hard to ensure all 3 of these buckets are in place. Now, like with 911, the expectation is this is not something, 911 wasn't developed over a year or 2, right? It took about 10 years to really get that infrastructure in place. And the expectation is kind of the same thing here. This is not going to necessarily be something that you're going to flip a switch and all of these resources are going to be here. But if you look at kind of these 3 buckets, someone to contact, that's 988. That got turned on in July of last year. So it's been on for almost a year, and Indiana's pickup rates are amazing. They have done incredible work. And I think they've moved from maybe, I don't know if you know off the top of your head, but anywhere from 10 to 12 minutes to respond to a call to maybe close to 40 seconds, I think, at this point in time. So very, very little calls dropped, as well as, it doesn't just say someone to call, chatting. So they have chat features, which obviously is really huge for youth in particular. So that bucket is something that's really already in place. And then someone to respond. So that really is looking at mobile crisis teams. So throughout the state, the expectation is there will be a mobile crisis team in all 92 counties. It won't necessarily be in each county, like we'll talk about with what we're doing with Stride, but can respond to all 92 counties, and a safe place for help. And that's Stride. And frankly, we've been used as the model for the state in terms of the work that we're doing. We have people come all over the country, but definitely people all over the state regularly, probably 2 or 3 tours a week, and probably about 7 or 8 a month. So, we definitely have a lot of people who are coming. Next slide, please. So those are the key components. And I think it's important just to see how these pieces work together. So you have an individual in crisis. The crisis line is available. What data shows is 80% of those individuals can be resolved over the phone, right? So you've got somebody who's in a crisis, at least just say, hey, why don't you give 988 a call? They are connected to 211. They're connected with the other resources. They're not necessarily connected with all the mobile teams or the crisis centers, but they're working on that. But then if they're not, they can deploy a mobile crisis team. So once all of those pieces are in place, mobile crisis team goes out. And again, the data shows from other states that have been doing this, about 70% can be resolved in the community. So you go out, you go to wherever it is they are. And I'll talk more about mobile crisis in a minute, but mobile crisis, unlike what we have with the Stride Center, that is for children as well. So that's adults, family, children. And then crisis facilities and saying 65% discharge to the community, which is really low. I would say, we're talking about probably 95% are discharged to the community. Other people, somebody might end up going to the hospital, or as I talked about, a substance residential acute care hospital, something like that. And occasionally, I don't know that we've had anybody arrested from Stride. So very, very rarely if we've had any. And then 85%, what does that say? Remain stable in community-based care. So that's the follow-up that happens there. And then what you see again from a graphical standpoint is decreased utilization of jail, ED, inpatient, which are the things we talked about earlier. And then obviously an impact on law enforcement and 911. Next slide, please. So, oh yes, sure. Correct. Yes. Yeah. It would be the people that they go out to. And again, that's a very low number. I would say it's, we're probably closer to 95% are resolved there, as opposed to somebody needing to go to a higher level care. And we can transport people to Stride from mobile when we deploy. So this just shows the number of guests that we've had over the last few years. Next slide, please. And then here are the demographics. And again, and this is almost 3 years worth of data that we have here. So if you look at the people that we're serving, primarily it's 63%, I think. I'm sorry, I'll just guesstimate 60 something percent men and 31% women that come. So higher percentage of men. I think the thing that's really important is really everybody who comes has a mental health or substance issue. So, we're talking about people who really need to be there. And if you look at the number of visits those individuals end up having, you can see probably about 25% just come one time. And I would say most of those people are people who have a crisis, but once that crisis is resolved, they're fine. They kind of go back to baseline, and maybe a situation where, it was kind of a one-time thing for them, or they just needed to get support or connected to a resource. But what you'll see from the data when we talk about housing status is vast majority of the folks that we're serving are unhoused. And you're looking at about 83%. And so many of those folks, again, are the ones that I'm talking about in terms of coming in and saying, hey, my number one issue right now is I need for you to help me with housing, or I need for you to help me with these other resources. So we're connecting those individuals, and again, working with the mental health issues as we go. And what we've seen is with those individuals, the more often they're coming in, the more improvement we see. Next slide, please. Just a little bit of data. Again, this just kind of gives you examples of all the referral types we make. So when we talk about, kind of we're working with lots of different agencies very directly, law enforcement. So and actually, can you go back to the last slide? I think maybe I missed that. No. Referral source. Okay. So you can see what percentage has been referred by the sheriff's office or BPD, IU Health kind of inpatient, IUPD, and those are all our primary referrals versus self-refer. So the vast majority of people are coming in on their own, might be a family member, might be someone else, but, again, I think Eve got it wrong, kind of in the beginning when she was talking about the fact that we only took law enforcement. We did that for about 2 months, but then we opened it up to the community at large. And in large part, it really was to assure kind of all parties that what we were doing could be trusted, that, you know, we were ensuring the safety of the individuals in our community. So, you know, I think that's been really great. And the other thing that we see is most of the people who come to us from law enforcement, they end up, you know, because it's voluntary, they can stay or they can leave. And a lot of times people will be like, okay, you know, I can go. And we're like, yeah. And they may get dropped off by law enforcement and they may leave, but oftentimes those people are coming back. And again, we didn't know if that was going to be the case kind of in the beginning, but what we've seen is, you know, people really do vote with their feet. So law enforcement might bring them the first time, but typically they're not bringing them back again. Individuals are coming on their own. Next slide, please. And then, yeah, just talking about the outcomes. So we do satisfaction surveys with all our folks. Out of 10 points, 9.33 satisfaction, confidence that their basic needs have been met is very high. Their mood before the visit, as you can see, is pretty low, and significant improvement in their mood after their visit. Average length of stay is, if anybody can read that, 3 hours and some minutes, maybe.
Less than 5 minutes.
Oh, the average length of stay, it's on the clock.
Oh. Yeah, 3.
Okay,
yeah.
thank you. I was like, I cannot read that at all, but okay, thank you. Next slide. So this is just some data that I think is really important to highlight. And you know, one of the things that we know is because of the Indiana Medicaid expansion, really everybody that we work with is eligible for health insurance. And if they're not enrolled, we are ensuring that they are getting enrolled, or we're connecting them with a navigator. And so in working with the insurance companies, you know, we really wanted to demonstrate, is Stride or Stride Mobile, is that doing what we hope for it to be doing? And the best way to really measure that is IP and ER spend by period is inpatient and ER utilization. So what Anthem did is they looked at the data for all of the people who had come to Stride for 6 months prior to Stride to that first visit, and then from Stride first visit to 6 months post. And what they found was a 30% decrease in inpatient and ER spend for those individuals. So that's really significant. And that was all of the people, you know, bundled in there. And then the per member per month, again, you know, a 30% reduction. And then as you look at the medical loss ratio is about 204%. And, you know, Anthem was saying, yeah, we break even at about 100%. And I think it's 130 something. So really made a huge difference in costs just from people voluntarily being able to come to Stride. Next slide, please. I know I'm going a little long. Is that okay? Okay. Stride Mobile. So January 3rd, we opened our Stride Mobile Crisis. And those are a team of 2 individuals. So you call that number, the number I had on that first slide, and that's the same number for the Stride Center as well as mobile. So kind of one-stop shop, give it a call. And what you're going to get is a team of 2 individuals that will deploy on site. We're serving Monroe and surrounding communities. Again, those individuals who would be deployed to hospital, we've gone to probation offices in Lawrence County. We've shown up at the jail if they're releasing somebody and they appear to be having a crisis, pretty much you name it. Schools. We've definitely done a lot of work with schools as well. So just wherever they need 24/7, 365, and we have been able to do it continuously since we started rather, serves adults and children, can provide transportation. That has been huge for Stride as well, because what we hear from a lot of our law enforcement partners is, well, again, if law enforcement shows up and they feel like, oh, we don't really need to do anything with this person, but they need transportation somewhere, it's pretty traumatizing having to go in the back of a car, right? I mean, it would be much better to have somebody come pick you up and take you to Stride or take you to, Meadows or wherever it is you need to go. So really having that transportation that's available, as well as if you have somebody who's at the Stride Center who, again, has a bed available in Indianapolis and it's 3 o'clock in the morning, but they're kind of like, hey, if I don't go right now, I don't know that I'm going to stay. They'll call mobile and we'll go pick them up and take them up to Indianapolis. So really having that transportation piece has been huge. And then we have at least 4 follow-up visits for anybody that we call mobile on. And that's really important because, you know, again, a person who's maybe suicidal and perhaps, you know, they went to the hospital, maybe law enforcement was there with us, they took them to the hospital, but they're released. You know, oftentimes that's what ends up happening. You don't necessarily stay. So then, you know, kind of what are those next steps? So ensuring that, you know, we're getting right back with those individuals and making sure that they get into the care, because that's really what it's about, is plugging them into care. Next slide, please. And so I think, yes, so this is just the data on the people that we've done. And I don't know, it's about 2 weeks old probably from the time that we started. So we did kind of a soft launch in November and December, and we're just doing some well checks. But in January, you know, we started 24/7, and these are the number of mobile responses we have had per month since we started. So pretty slow going in the beginning. And we kind of wanted that deliberately because, you know, we're obviously training our staff, taking, you know, new folks on, even, you know, just having the number of staff has been a little bit of a stretch in the beginning, but we're in much better condition here at this point. The other thing that you'll see is urgent versus urgent and emergent versus a welfare check. So again, somebody we need to go see immediately. Whereas if it's a well check, we can say, hey, you know, we've got something, can we go in 2 hours? Yeah, it doesn't really matter what time you go for that particular person. So we're triaging that information. So what you can see is 33 minutes is the median response time regardless. So that is really fantastic. And again, we're serving not only Monroe, but surrounding counties. I'd say most of the time in Monroe, it's about 10 minutes, which with law enforcement, that really makes a big difference if you're able to, you know, be there immediately. The number you can't see behind that, which I think is really important, is a 93% diversion from law enforcement. So again, really just ensuring that those individuals don't end up where they don't belong. So next slide, please. So these are so median response time. So the first one you already saw. The second one is the average time to resolve the crisis. So it's about 106 minutes is about how long it takes on average when we're going and meeting with people. Next slide, please. And then just some demographics of the individuals that we're serving here. So, you know, you can see most are adults, 7% youth, fairly even gender split here, unlike what you saw at Stride. It's closer to 50-50 with men and women. Pretty similar in terms of, well, maybe some differences as far as race and ethnicity. I feel like with Stride, we've done a really good job in ensuring that we're accessible to the demographic and the population that really needs us. And I think we've got some work still to do with mobile. And then next slide, please. This just shows the counties that we've served. You know, we opened in Bloomington, but we're also have a second Stride Center that we opened in Columbus, and we have limited mobile. We're going to go full time with our mobile in Columbus August 6th. So in 6 days, we'll be 24/7 there as well. And I would imagine some of those numbers will shoot up. But and again, you can see a lot of law enforcement calls, and then on the bottom is self 20%. And again, part of this is just getting the word out that this is available, which is why I'm glad to, you know, kind of have the opportunity here, because I think a lot of people still don't know about it. Next slide, please. So these are the locations. Again, one number, that's the only number, you know, you need to call, and folks will be able to triage that for you. And then next slide, I think I have one slide left. I promise. Yes. So a lot of people just ask, okay, you know, it's confusing. What do I call? What number do I call? How do I, you know, just make sure that I'm kind of doing the right thing? And this is just a nice little infographic with some information that just says, here are the things you need to do. Now, on the bottom, we're like, you can call 988 and you might get to Stride and you might get to mobile. You might not. So I think it's important to say, 988 for sure if you need to call somebody, but to also have that number for Stride and for mobile so that you can go directly. Now, eventually, again, once the state has all that infrastructure in place, they will be able to dispatch, but that doesn't prevent anybody from ever having to call us directly. And the thing I will say is there's just a lot of questions. If somebody wants to have a tour, we set Stride up so that people can come, they can look around, they can meet staff, they can ask questions. Same thing's true with that number. A lot of times, people may have a loved one that's struggling with mental illness or a child, or it just feels like it's so out of control. I don't know what to do. It's always okay to call. There's nothing wrong with doing that. And I think the more people that call, get comfortable, ask questions, have their questions answered, the more comfortable they'll be with that and more feedback we get. The last thing I will say is, we're working really hard to make sure that we have all of these pieces in place and we're doing it right. But this is an ongoing conversation, right? I'm very confident that there are times when, things won't go exactly the way we need them to, but really want to hear back from people, really want to make sure that, all of the pieces that we're putting in place are pieces that are working well for everyone throughout the community. And I know we don't really have time for stories, but we have a lot of great successes as well. And, happy to share that another time.
Thank you so much. I'd like to hold off on questions until we hear the second presentation, if that is okay with everybody. Okay, so the next presentation that we will hear is Ms. Marilyn Grimes from Courage to Change. Welcome.
Thank you. Can you hear me? Yeah, there you go. All right, so you basically asked me some questions when you sent me. So I think I gave you sheets. She's got them. The answer, but I'll tell you. You asked what services Courage to Change Sober Living currently offers. Basically, we're a low barrier, affordable, peer and staff supported transitional housing to those suffering from substance misuse. And we have 2 women's houses and 2 men's houses at this point. We have 26 clients. We are in the midst of adding 10 more men's beds, which is really needed because we find that there is more men in need than there are women. So our houses include a case manager for the men and a case manager for the women. And they have curfews. We do drug testing. Yeah. There you go. Okay. So I was saying about the houses. We have case managers for men and women. And they're monitored, although we don't have live-in staff. We do have house meetings and they have to go to 3 meetings a week, do chores, they're assigned chores. And they have to have a job within 2 weeks of coming to us. We're really strict about that because that's part of the structure of getting back on your feet. And then we do have a new software so that we actually can GPS their meetings and their housing. So when they check in and out of the house, we know they're there because we do have curfews, which are 11 through the week and midnight on the weekend. And then it also GPSs the 12-step meetings, which are a requirement, which helps them to be accountable and us keep track of, that many people. You ask, how are these services currently funded? We're funded through grants. We apply for as many grants as we can. Bobby does, our treasurer. We also are funded through Sober Joe Coffee. So he sells coffee and then he gives us the funds he makes to use for housing mostly for the clients if they need help. Our residents also pay rent. Our rent is $575 a month, which is really low considering, it's everything except for the food. They do have to take care of their own food, but that includes Wi-Fi and we have a computer in the houses. All their bedding we will supply. They all have washer and dryers. So these are nice houses in different neighborhoods, just so you know. We rent houses, which is really makes it difficult. But the other thing is we're in different neighborhoods. So we have good neighbor policies. I have to throw this in, sorry, because I'm really proud of it. Because instead of going, they're just learning how to live in a regular setting. Like we have one house in Highland Village. We have one on South Rogers. The neighbors don't know we're sober living. We don't advertise it. But I did have a gentleman that has a rental house next door to one of ours and came to me and said, could I rent to you? Because you take such good care of your houses and I never see any problems. So that just shows you that, I mean, because they can be proud of where they live. They're not just put in any place. It's not set up so that it's an institutional feeling. It's their home. One of our houses I always tell them, well, it's like going to grandma's house because it's just that comfortable. And we supply TVs and, the things that they need. So we also are certified through Recovery Works, which is a state funding for anyone with a felony or a pending felony. They can get a referral from their probation officer, or if they're on parole, and the state will pay for like the first 3 months completely. And then they titrate it down. It goes to where they pay 100 for the next 3 months, and then 200, and they max out at 300 a month. When we let our clients stay for a year, so that gives them the opportunity to be able to save money, come up with a goal. We work on goals, so they can set a goal for, being able to move out. So we want them to be really stable when they get ready to move out on their own. So, because our clients, 95% are from Monroe County, they're going to live in this county with us, and we want to make sure that they're ready and that it's not going, that, the substance misuse is going to be at bay, and they got a good support system, of which we do have a really good support system within our alumni. They all stay connected. That's the other thing they can do through the app we have. They can stay connected with each other. So I'm sorry, I jump a little bit, but so I think I told you about the monthly. We do also offer grants. We apply for grants to help our clients if they're not on Recovery Works. That way we can give them like a month's worth, so that no one has to be without the ability to stay with us. Money is not the biggest issue. Also, because a lot of our clients are on drug court, reentry court, the different kinds of court systems that actually, if they miss meetings, they can be put back in jail for a couple of days, just part of the punishment. So it's okay. Basically, it's okay. Come back to us. Also, if we have a person that relapses in our houses, we don't kick them out. We want them to stay. We want them to get back on their feet. Relapse is part of recovery. So we will put them on contract, or if it seems more serious, we will ask them to go to detox or to treatment for 30 days. And during that time, we do hold their bed, because we also, again, want them to come back. They've started, the relapse just happens, and you just want to work with them to make sure that they can have a place to come back to. And that one way we won't have them back in jail, which we don't want them back in jail. So we do have a 75% success rate also for our clients. And you asked, are the needs of the organization currently met? Well, money. It's always money. We have a waiting list. I'm sorry, I meant to bring you, I have a stack this big that's coming in the mail from the jails and prison, but we also take online applications, and in 3 months we had 75 applications online, 3 months. and then the stack of paper applications. So there is no way we can house as many as need help. One of the things, we do take people from Amasis because Amasis is a 3 months program and they go in there and they get, they get real stable. So they're ready to move on to a less restricted place. They're ready to be more on their own, but they still need definite accountability because they're not completely ready to go out on their own. So, sorry. So, we always had that. And so we really need more houses, basically. One of our problems that we find is the rental in Bloomington for us, because we started in 2016. We're still here, but we don't have the money to buy a house. And when we rent, as you know, rentals in Bloomington are extremely high. And we pay all the utilities. We have insurance on our houses. Recovery Works, that's part of their, one of the things that you have to have. And they're even stricter than hand as far as the safety of the houses and how they look. They want them to look like nice places to live, which I think is great. So we're on our, I told you that it looks like we may be able to open another house and we'll hold 10 men. The one thing we're not addressing is MATs. There's a lot of people on MAT, even through probation. I think that I know Perot does, they allow them to take Suboxone or methadone, but we can't put MATs with abstinence. It's, if you understand about substance misuse, it's a mindset partly, and you have triggers. And so if you have someone that's on MATs, which essentially is, I hate to say it this way, but it's using, but it's stabilizing them, right? But then you have other clients that are doing nothing. And then you end up with the problem of that client asking that one, could you, could I have a few of those? That sort of thing. One thing Recovery Works is real strict about, no medications can be out in plain sight. And also with MATs, we have to monitor more. So to have a house like that, it's going to be more oversight. But it also, I tried putting MATs with abstinence and it didn't work. So, I mean, it is something tried that it won't work. So MAT houses have to be separate. Doesn't mean they're treated any different. It's just, the situation that has to be oversaw. You have to oversee it more. So we'd like to have a house. So what we really could use is money to buy a house. One of my houses, I pay $2,500 a month. That's just the rent. So we don't make a profit. We're a nonprofit. Well, we are a nonprofit. We have to do grants. We have to have all these other things to keep us, going. And I'm glad that we have Recovery Works, which helps people, but it also helps us. It doesn't give us a lot extra. We get about $50 more a month off of Recovery Works than the $575. So it's really tough to grow. And if we had a house that was purchased, it would come back into us instead of giving our money to someone else. We wouldn't be paying that kind of rent because house payment, even if we had to incur house cost, insurance, taxes, or anything like that, it's still not going to be what we have to pay in a rental and all the utilities and insurance. So that's really what we need as far as funding goes. We appreciate the grants we get. We appreciate the help we get. Do you have any questions?
Yeah, thank you. I guess this is the time that our committee
Okay.
will open it up to questions for both presentations. So who'd like to go?
I do have a question about the potential for freeing up funds for operations should you have a purchased building for housing. Have you looked into, have you verified that Recovery Works money or the other money that's assisting with rent could be used for non-rent type costs? So if you're getting money from a program that's supposed to be helping the clients with the rent, are there restrictions then on what you're using that money for?
We're using it for the rent. I mean, is that what you're talking about?
Yeah, but if you didn't have that rent cost, so
Then
say,
everybody would be paying $575 a month.
I see, so
Yeah,
there wouldn't
Recovery
be
Works
that
only-
subsidy
sorry?
then you wouldn't have that subsidy for your clients through Recovery Works?
Recovery Works only helps them with the funding to cover the housing costs. Their stay there. They don't give them anything else as far as housing.
You would still get those funds from Recovery Works.
Okay.
I mean, as long as you're certified, even if you had the house paid for, I think that's what she's asking.
Is that
Yeah.
what you're saying?
Yeah.
Yes,
Mhm.
sorry if I
They
wasn't
don't-
clear.
That part they don't care about.
Okay,
Yeah, no, I'm sorry. This is all recovery. The way Recovery Works work is you get a client. And if they're on probation, you have to send a letter to the probation officer. They send it to the state and say that they've been accepted into Recovery Works. Once they're accepted into Recovery Works, then they start paying the funds and it's billed weekly. So I bill weekly for
Okay.
7 days stay
okay.
and that's how it works.
And it
I'm
goes
sorry.
straight into your operations or whatever you need. Got
Yeah.
it. Okay, thank
Sorry.
you. I'm sorry if that was
I'm a little
confusing.
dense sometimes.
Go ahead.
I don't think your mic is working.
You were asking about funding for Stride Center, correct? So initially it was funded through an IU Health Foundation grant that paid for half. And then there were matching funds from Cook, the county, the city, that funded us for the first 3 years, which ended at the end of December, but because it was COVID and we got kind of a late start, those kind of that last year's worth of dollars, or really some of the first year, has managed to get us through most of this year, plus some SAMHSA grant funding. We got some SAMHSA grant funding last year that we've used for Stride, which is what we're using right now, or we used until about a month ago. And then we applied for a DMHA grant for the Stride Center, and that was fully funded, well, mostly fully funded. So that is how Stride will be paid for the next 21 months, is Division of Mental Health and Addictions. So we got a grant for that. Yeah, you're welcome. Mobile is different. That is kind of, that's another pot that we're applying for, just FYI, because, you know, Stride is 24/7, Mobile is 24/7. They're co-located, but we do have that. And for Mobile, we are actually asking for another IU Health Foundation grant, and then have some matching funds for that. But that is kind of the lion's share of it. And again, very much a community partnership.
I actually had a quick question for you. You had mentioned like guests are allowed to stay up to a year, like a year. My question would be, let's say a year comes and they're not ready to go back out yet.
Well,
What happens?
we let them stay.
I figured since you had said,
Yeah.
you know, people
I mean,
relapse.
Our
But-
goal is that they make it,
Okay.
you know, so if they really feel like they're not ready, we started out with Courage to Change with 2 years. The thing was, we had our turnover, you know, we couldn't help a lot of people, so we brought it back to a year with the understanding if they're not ready, then we would let them stay longer.
That's good.
Yeah.
That's good. Anybody else?
I'll go again. Regarding the medically assisted treatment, you indicate you've tried that, but you didn't try it in a setting that was isolated from abstinence.
Right.
And that's something that you would be interested in trying if you had separate spaces?
If I had another house, we would open an MAT house.
Okay.
Yeah, definitely, because there's a great need. I have to turn down a lot of people because we don't do that. And we're a really good program. We've got success, you know, and it would be good for them too, because some people, my son's on Suboxone, okay? Some people have to have it. And I understand that. Not everybody can be abstinent, and that's okay, but they still need the help. Because when you come out of incarceration, there is nowhere to go unless you're going to go back to what you were doing. And that's not a good situation usually. That's usually, you know, so I think the answer is more housing for those coming out of incarceration. I've just seen such success with it. It's, you know.
Guess who came out of Courage to Change? Me, your girl. I actually, besides, I do have a statement to add on to Maryland's. Besides working at New Leaf New Life, I also am the board president of Courage to Change Sober Living. So I have a lot of information about that program as well. Number one, I stayed there for 17 months. You know, I'd still live there if I could. I really would. I was thinking, you know, I would definitely, it is definitely, I went through Amethyst House first. So it was like the Amethyst Courage to Change combo that really saved me, right? And Amethyst House, you know, got me ready for semi-independent living. And then Courage to Change got me ready for independent living. And while I was there, I then, you know, I also am a felon multiple times. Sad about it. But I also got recovery work. So it allowed me to save money to obtain independent living. And I was under the old 2-year contract. And when the board changed that contract, and when we came together as a group to change that contract, we also put clauses in our contract that says you are eligible for extensions based on application through your case manager. So yeah, that program, the longevity, I mean, 90 days at Amethyst goes so quick. It goes so quick, and like, where am I going to go? What am I going to do? Especially if your local sober living houses have waiting lists that are like this huge. I got lucky and they got on top of me going to sober living pretty quick at Amethyst. So yeah, if they had we have to turn away folks coming out of Amethyst too, right? For multiple reasons. Maybe they're on MAT, maybe we just don't have the room, right? Our women's houses remain full. They've been full and they're stable right now. Our men's houses remain full. We don't have one spot. I mean, I wish I could take folks who are coming out and put them on our couches until we can get, like, it's that serious, you know, but we just don't have the space. So like working with other organizations like Oxford House, you know, has really helped me along. I haven't particularly had any luck too much with the rec, because I think sometimes those beds are reserved for folks primarily maybe coming out of Centerstone programs or into our problem solving court. I can't say that for sure because, you know, I'm not involved with Centerstone, but I haven't had too much luck with the rec as far as getting folks in sober living. The men's rec.
Yeah, we're actually transitioning that. That was a very, kind of a intermediate where we were working with people with problem solving, but we are moving to a level 2 rather than, kind of where we were before. So hopefully that'll open it up. But we also have a women's 8-bed facility that we've operated for about 4 years, I think. Which, again, we've had tremendous success, and we do take individuals with MAT. Now, sometimes I'd say our beds in Bloomington we just don't have that many. We only have a couple of houses, and that's been something that we've really been focusing on as well. And finally, the Division of Mental Health and Addictions put out an RFP for recovery housing. So there is an RFP that's out for that at this point, but recovery housing is number one need. I mean, there is absolutely no doubt about it. That is huge. So absolutely focused on, having as many beds available as possible. And, I think the more community partnerships, the better.
Yeah, I have no problem getting folks He's not? Okay. I have no problem getting folks into detox or treatment. The only problem I have with that is like the barrier between me and the jail. And like we do in-house mail, so we facilitate treatment applications to folks who are in our county jail to help out the public defender's office to kind of bridge the gap there of those guys. But again, one of my biggest successes was I was able to stay in my community and get sober, right? I've been sent to South Bend to treatment. As soon as they sent me back here, I relapsed the next day. Right. Have nowhere to go. So I don't know that the problem is the detox and the immediate treatment. It's the sober living afterwards. Like, okay, you've gotten better, you've detoxed, you're stabilized, and now you got to go in the street because we have no sober living beds. Huge need for this community.
Let's see if anybody that is participating online, if anybody has any thoughts or any questions to this presentation? Nope. Okay. Anybody else here? Yeah, go ahead.
I was just curious. So the Stride Center has 23 hours. If there is a period of time in between that 23-hour cutoff point and a treatment bed being available, what do we do in that interim period?
Kind of the same thing that you were talking about. I forget the name. Marilyn, right. Marilyn was mentioning, we do whatever we need to do to try to get, sometimes people are, especially over the weekends, it might be 36 hours, it might be, 48. Technically, Division of Mental Health and Addiction says no more than 23. We'll do a walk around the block and kind of reset the clock for those individuals. So we just want to make sure that, it's the biggest part is just making sure that people understand it is for individuals who are in crisis. We really can't be, sort of a homeless overflow, that kind of thing. We don't do meals. Oftentimes, we have snacks that are there. Oftentimes we have individuals that, maybe if they need to be here a long period of time, we'll go to Wheeler and we'll pick up meals or bring some food for them. But, so we want to make sure people are able to get there. But at the same point in time, we want to also make sure that it doesn't become a drop-in center, because we have that in our community. Did that answer your question?
Yes. I was also just thinking about the transitional care facility that used to exist. And I was wondering if there's anything that was similar to that for folks that were coming out of the hospital. Maybe it's not quite the Stride Center, but it's something else that's Centerstone adjacent.
Yeah. Well, that came up last time in talking about, the need for transitional mental health crisis services, but that's longer term, right? So TCF, Transitional Care Facility, was a 12-bed facility where it's actually where Substance Residential is now. And, again, it was kind of the same problem that we ran into, that ran at such a financial deficit. And that was part of the conversation we were having before in terms of Substance Residential. There's payment for 30-day Substance Residential. For mental health residential, there's no payment. There's nothing like that. There's not an equivalent. You can get some services, you know, you can go to the hospital, you can go to an acute care hospital, but most acute care hospitals you go to for a mental health, maybe 5 days, right? I mean, you know, if you're lucky, you might stay there. So I think when people think about like, oh, we need more resources that are sort of like that, that's where we have to talk about parity. You know, we don't have financially, there are not the same kind of resources available on that mental health front. So that is something that is definitely a need for that, you know, that in between term stabilization. But, you know, right now there's just not the funding for it.
I do have one quick question. What does Stride consider a crisis?
Well, the crisis is typically defined by an individual, right? So, I mean, I would say everybody kind of, I mean, it's based on that individual that shows up. And if they say that they're in crisis, I mean, you know, we honor that. If they say I'm here because I just need, you know, a place to stay for a couple hours. I mean, and again, it just kind of depends on how that individual presents. But if they present and, you know, that it's very individualized. I mean, what one person might consider a crisis, somebody else might not.
Thank you.
So I had another question for you, Linda. The mobile crisis response, you said there were teams of 2 people and, you know, your numbers are going up and you're getting ready to launch in Columbus. Do you have enough staff? Are you able to hire enough, both financially, and are there enough out there who are qualified?
Yeah, that is tough. I will say, you know, it's nice because I think there's a subset of individuals that are really excited about crisis work. You know, you're able to, you know, kind of like EMTs or, you know, something like that, where you're able to go in, work pretty intensively. So we have, I think, found some different people who, you know, typically might not be interested in mental health positions, but it's tough. I mean, we've really struggled with staffing. I know I have staffed overnight a lot first, you know, 5 months. And that midnight to 8 a.m. when we haven't had a lot of call volume, as opposed to having somebody on site paying a stipend to do the call and then show up. So having people deploy from home. So Stride would call us and say, hey, Linda, you know, we've got this person here, this location, you need to go to them, as opposed to sitting around all night waiting for that. So, you know, we've had some flexible staffing because we haven't been able to be fully staffed. But at this point, we're very close to full staffing. And when we were talking about the numbers, you know, I think we've probably gone over 210. So our volume is really, you know, kind of week on week is really going up. And again, I think the more I do these presentations, the more information gets out, the more we're hearing. So knock on wood, staffing's a little bit better, but, you know, we had to delay the start of mobile a long time till we got to the January 1st. And it's kind of the same thing in Columbus. You know, I think we had hoped to open in the beginning of June, and, you know, it's August at this point. So staffing is definitely a challenge for sure.
I just had some follow-up on the mobile crisis unit when responding to calls for juveniles. So are you able to transport juveniles then, for example, when they get released from the hospital and there's that interim period? Okay. And then from your perspective, are there enough facilities for juveniles in order to provide mental health support?
No, I mean, that's a real issue. And I think even in Bloomington with Stride in the beginning, you know, when we were looking at models, sort of crisis center models, for the most part, the places we saw were large urban areas. And, you know, they kind of had the volume that, you know, we're like, is Bloomington, is it going to be the same? Are we going to have enough? You know, even when we were talking to law enforcement, we were like, how many calls a night do you think you might be able to divert? Well, maybe a couple. You know, it wasn't necessarily like huge numbers. And I think we run into that same kind of problem with juveniles. I know when we got our mobile crisis grant that, you know, kind of started this, it's a SAMHSA grant. We were one of 12 nationwide that were awarded. And we had a grantee meeting, and we met with people in St. Louis and other places where they do have some juvenile diversion centers. But as we look at sort of what you do in Bloomington, it may need to be respite centers. You know, I think we're going to have to look at coming up with some alternatives for juveniles to ensure, you don't necessarily have to go inpatient or, something like that. Because at this point, no, there's not enough. And I think that's really something as a community we need to be talking about and looking at. And sometimes, it might be respite for the parents too, in terms of just saying like, I can't handle, the kid for the rest of the night. What do I do? So I'd say having some solutions and alternatives would be really helpful. We still haven't seen very large numbers yet. So I think it'll be interesting as we kind of look at the data to see what the need is. And that's part of it too, is I know when we were doing our training for Stride and we came up with all of these scenarios of the people that we were going to see or the prices that they were going to have when they showed up. And we were like, we got every scenario wrong. Like, we haven't had any of those because you just can't really anticipate. And I think it's kind of that same thing. I think we need data. And as much information as we can get at this point.
Okay. I'll take a stab at one last question here, and this is for you, Marilyn. I know in our handout here that you have mentioned that more funding for staffing is available or is needed so that you can open up more housing options. How much staff are you working with right now?
We have, Stacy has 10 women and Jason has 16, and I'm the executive director. So I just kind of, I do recovery works billing, and then I do everything that to help take care of the houses and then fill in. Both of them do really good jobs, but we only have 25 hours. They're paid for 25 hours a week. So we have house meetings, we have oversight. So we all kind of work together. Even Misty, she's a volunteer, whatever you want to call it. She's the board, but she goes by and checks the houses. So we do spot checks. Okay. Even though, we have accountability in other ways, but yeah. And so we would have to have 10 for one person is a lot. I help Jason because he's got 16. So that's really the most anybody should have. So we'll have to have another one for this new house. It's going to have 10. So we'll have to have another men's. And then if we have a MAT, it doesn't have to be full-time staff, but just a little more oversight, because you still have to, even though they, that when they go to groups, I know that they check on it, but we'll still have to, just to make sure.
Also, all of our houses are monitored by cameras in the common areas.
Yeah, we do have cameras.
So we do have cameras in the common areas, not in the bedrooms, or in the private areas, but we do have them. Just, in case.
Yeah. And they all sign consent
Okay.
that they know they are being videoed, as they're coming in and coming out. We don't allow company. They can't have any outside guests other than family, immediate family and sponsor. Other than that, that's it. They cannot have any friends over. It just, you're trying to build a community within the house. You start bringing more people in, it causes more confusion. So we are strict about that. No men at the females' houses either. We're really strict about that. But it has to be.
Okay. All right. Well, thank you. And now that as we are wrapping up our meeting here, I just kind of want to shift the conversation a little bit, just for some final thoughts on for the committee, everybody here at the table, your thoughts about Intercept Zero. And I'll start it off. I see Jory McIntyre had made a comment here via chat, and it says, to answer the question, how do we divert individuals away from incarceration? We must know the reason why folks are getting incarcerated in our community. We need open access to this data to answers these questions and create solutions as a community. That is definitely necessary. One last thing that we have here. I know Miss Beverly Callender Anderson from the City Family and Resources Department. She was on here via Zoom and she had to leave, and she wanted me to read the following that she said. But she said that she believes that we are on the right track of having stakeholders working together, like heading home, stride, etc. Out of the JFAC meetings, we can agree on community priorities without keeping a rally of who pays for what. I believe we'll all come together better. We have to agree that grant funds go to community agreed upon priorities first. We have two great models to follow to move forward. That was what she said. So again, any last minute conversations or anything that we've heard in relation to Intercept Zero on how to divert people out of being incarcerated in the first place?
So I have a source here that says an analysis shows mental health illness are significant causes of Monroe County Correction Center overcrowding. Among the top 10 booking types, and this is the source for this is Monroe County, Indiana Criminal Justice Project Strengths Assessments and Gap Analysis. That the number one thing people are arrested for are operating while intoxicated. Number two thing is violation of terms of placement. Number three, failure to appear, probation violations, possession of methamphetamine, public intox, and possession of paraphernalia. None of those are violent charges or dangers to our community.
Mm.
And I think that like that just says a lot right there as far as Intercept Zero goes. Who are we arresting? Why? And also there was something in the Herald Times, and the article was written September 19th, 2022. And in 2014, the red dot I have are persons that are booked once was 60%, and persons that were booked twice were 39.8% of those people were booked twice. In 2018, that increased to 50.7% of people who were booked twice. And I don't have any data after that. So there's definitely an increase in people recidivism rate from 2014 to 2018. And I know that a lot of things that I was arrested for could have been diverted to something else. You know, I was often in crisis. They didn't have Stride when I was in crisis. They had the police, you know, and people called them on me. You know, that's just how it goes. I also have all those arrests and zero violent charges. Why are we locking people up? And I do understand, like, operating while intoxicated, that's a danger to our community, right? But failure to appear warrant, maybe like access for people to have cell phones so that they can have calendars on their phones and abilities to charge them, or safe places they can sleep so they can make it to their appointments the next day. Like, these are the reason why people miss court. Substance misuse. They're too intoxicated. I remember sometimes when I would use drugs, I would have to get high to make it to court, and then I'd be too high to go to court. Like, there's no balance there. So like, I had the intention of, I'm just going to do enough to get well to go to court. Well, I'm a heroin addict, so I would use until I was unable to go anywhere. And it was always failure to appear for me too, all the time. Probation violations, you know, and then to the point that they even suggested drug court. And I was like, I can't even go to regular court. Like, this is going to be bad for me, you know? So I think, to, you know, partner with what Jordan said about know who we're arresting, know what's going on as far as like folks that are going to jail, and that these are non-violent offenders oftentimes.
And I think to your point and Jordan's point about having the access to the data. And I know recently County Council gave approved funding for the, I'm doing it again, the Center for Collaborative Research. And I know Commissioners and I don't know, I see Commissioner Thomas is on, so I don't know if she wanted to speak to this as well, but I think the idea is to have the research and to do surveys of those that are incarcerated and formerly incarcerated, and maybe have a dashboard of all of this information that is readily available to help us with that, even, you know, as we talk about recidivism and reducing it, and, you know, talks of what we do next in terms of a facility and whatnot. So I don't know if Commissioner Thomas had anything to add on that. I'm sorry.
I don't. You've got it spot on. Thank you.
Okay. All right.
And we are looking forward to that study moving forward now that we have it was approved by the commissioners and now it's been approved by the council for ARPA funding. So it is now funded and we're very interested to see the results, and it's something we hope we can continue studying and understanding moving forward as well. Thank you.
Okay, thank you. All right. Any other final thoughts about Intercept Zero before we move on to public comment?
Just a short question. Does 911 divert to 988 in any cases that are they talking to each other?
Can you repeat that? We
Oh,
couldn't hear
sorry.
you.
Yeah.
It's
Does
okay.
911 talk to 988 at all as like a?
So the way, I mean, the complexity with 911 is every county or city has their own. So it's not like a 911 across the state. In Bloomington, it goes through BPD, Police Department, and there has been kind of a 911 work group task force where they're looking at that. But I also know just based on their data, it sounds like their call volume, in the last year has been up by 40%. And again, that's alarming, right? Because when you think all of those calls, I mean, as you're talking about, if it ends up being law enforcement, that's what you're potentially going to get. They are talking about, kind of thinking about what you might divert or how to do that. But I don't know that there's any firm conclusions, but there is a conversation going on with that as well. And making sure that I think BPD has recently or in process of hiring a social worker to work with dispatch. So that's part of it as well, as kind of when I was talking about training. If you really have somebody who's answering the phone that can say, okay, yeah, this would be an appropriate one to divert to 988, or we should call mobile crisis to co-deploy in this particular situation. So it's work in progress.
Okay. All right. Well, thank you again to both of our presenters for sharing your information, especially Ms. Marilyn Grimes. I've heard much about it, but I don't think a lot of the public has heard. So I appreciate you, giving an update. And Linda Grofal, thank you for giving an update on Stride and the mobile crisis unit. All of those things. So I definitely appreciate that. And I know you gave us a handout for Courage to Change, Sober Living. So what I will do is I'll work with our council staff so we can put this online as well, since your presentation also is available for people to reference as well too. So again, thank you very much. Now we are going to go ahead and move to public comments. So okay. Apparently there is a list that is out there of public comments, so we can have that back. Okay. Okay. Awesome. Thank you. And what we will do is we'll also monitor here for those who also have, we'll try to alternate in case we have people that are wanting to make public comment virtually as well. But we'll start off here. We will announce your name. You'll come up to one of the microphones here, preferably this one over here, and you'll have 3 minutes to make your comment. So the first comment that I see is Maria Douglas. So come on up. Feels like the price is right. Thank you so much. Turn your mic on.
Hello, thank you so much. So good afternoon. I am Maria Douglas, a resident of Monroe County since 1994. And today I'm giving public comment as a county council appointed member of the Monroe County Women's Commission. Currently, the Women's Commission's purpose and mission state, the commission shall serve in an advisory role to assist residents, businesses, and the government of Monroe County in addressing issues of gender equity in all aspects of society. The mission is to advance the status of women in all areas of county life, and to champion women's contributions to local culture and society. So the Women's Commission intends to walk alongside the Justice Fiscal Advisory Committee, county officials, the sheriff, and the jail commander to ensure that the issues that specifically affect women and marginalized genders are considered when discussing the local justice system. And I do want to thank Linda. I did notice that their data had females, transgender, and gender nonconforming. So thank you so much for that. The Women's Commission is privileged actually to have one of the only 25 people trained in the state of Indiana on the sequential intercept model mapping that you guys are using. And so we're encouraging actually moving beyond the informal use of the sequential intercept model to engage in formal mapping in the formal mapping process, which can be requested through the National Alliance on Mental Illness, Indiana. So Commissioner Kathleen Sobiek is ready to assist with the application, although she cannot be the facilitator. We also want to point out, as you guys just did, that there are gaps in the data for the current Monroe County inmate populations and those being served. So it is our understanding, and you just confirmed it, that there are entities working on updating those statistics, and making the jail statistics transparent and accessible to the public is imperative. So regarding today's topic of diversion intercept zero, along with the reading suggested, and we love that, we found two reports of interest. The Vera Institute out of North Carolina published findings from the 2022 study called Women's Pathways into and Out of Jail in Buncombe County. Three things that we wanted to point out is that they suggested expanding peer navigator programs. So that's something that Mary Morgan talked about. That's something that's been talked about here as well. Allowing in-person and video call appointments when there's children in the home, and eliminating fines and fees, which we've also talked about. So that's great. The other report is the Community Legal Services of Philadelphia from a 2021 study called Supporting Women in the Criminal Legal System Through Access to Diversionary Programs, providing childcare and transportation, as have been mentioned a few times, making sure records are expunged in a timely manner or diversion is pointless, ensuring programs are gender and trauma responsive. So we also want to end with when women are caregivers and primary or sole wage earners for a family and encounter diversion of programming that requires time and money, entire families can be trapped in poverty, possibly for generations. So we have the chance to stop that cycle here in Monroe County. Thank you.
Thank you. Would you be able to share a copy of what you read with us, just because those resources would be great? Thank you.
Awesome. All right. I don't see any raised hands via Zoom. Oh, I see one. Denny Wise. Welcome, and you'll have, once you're unmuted, you have 3 minutes.
Hello, I think I'm unmuted.
Yes, we can hear you.
All right, thank you. Okay, so hello, thank you for this opportunity to speak. I will try to keep my remarks brief. I'm a citizen of Monroe County. In my opinion, the biggest thing that we can do to divert people from jail is not to build a bigger one. This spring, the county council published a memo stating that it would consider funding a jail with a bed size of up to 400 beds. Given that the jail population has consistently been under 200 this year, I've been wondering why the county is planning on doubling the number of people incarcerated. As a member of the public, I'm confused by the county's simultaneous commitment to incarcerating fewer people and to building a larger jail. It seems to me that we're going to have to choose between these two futures. Either more people are going to be incarcerated or fewer. We should build for the future that we want to create, and I believe that we are all here to want a future in which fewer people are incarcerated. So it would be good if we could set some goals for ourselves and hold ourselves to them. Given that a new jail will take approximately 5 years to build, how much do you think we can reduce the jail population by then? By 10%, 15%, 20%? If the county really and truly means to reduce the jail population, which is the whole point of diversion, why are you planning for an expansion? Why are we planning to invest vital resources and infrastructure that at best will be left unused, and at worst will be used to incarcerate more people than we currently are? When it comes to jails, extra space is not a good thing because it will get filled. In the words of former jail commander Sam Crow, quote, "If we build a bigger jail, kind of like building dreams, if you build it, they are going to fill it," end quote. It is contradictory to sit here and talk about diversion while planning a jail built on the pod system of indefinite expansion. We don't want pods, we don't want a bigger jail, and we don't have to go to a jail campus to get mental health care. Thank you very much.
Thank you. All right, next up in the room, we have Josie Everett. Hi.
Do I push a button or?
Just make sure you have it really close.
Okay, so my name is Josie. I'm a citizen of Monroe County, and I also wanted to talk about, if you really want diversion, don't build a bigger jail. Looking at the average inmate population from the 2022 annual jail report, the inmate population has consistently been decreasing since 2018. So pre-COVID, I lost where I was at, sorry. It's a waste of resources to build an even bigger jail than we have right now, especially with a greater commitment to diversion out of jails. According to the same report, our current jail had an average of 85 empty beds throughout the year out of a total of 294 beds. As the previous public comment mentioned, in a memo, it was stated no more than 400 beds would be needed, with estimates ranging from 393 to 450. So again, why would we need anywhere near 400 beds if we're making a commitment to divert more of the jail population out of jails? By building a new, bigger jail, your actions are supporting an increase in jail population, and it's a direct contradiction to diversion. Thank you.
Thank you. All right. I don't see any hands via Zoom. So next up here is T. Randall.
Hi, I'm T. I'm a member of the Care Not Cages and a resident of Bloomington. I feel like it's already, or what I was going to say has already been said well enough, so I'm just going to ask the Centerstone. It was asked, what is fully staffed for the Stride Center? Or what would the number?
The number of staff, probably about, it's about 11 to 12 FTEs in terms of, 24/7, 7 days a week.
Right,
So it's three shifts.
and how many staff do you have now?
How many staff do we have at Stride? That many, 12?
That many?
Mhm.
So you are almost.
Yeah. Mhm.
And how many mobile crisis units do you have?
Again, the staffing's pretty similar. We're looking at, I'd say right now we're at about eight and a half FTEs total, and fully staffed would be about 10, 11. However, again, because that third shift, we're really just doing with on-call extra staff. So right now that's fully staffed.
And I did some back of the napkin math from some of the numbers you gave in the presentation. It seems like you're doing roughly 3 to 5 in person.
Mobile or Stride?
In the Stride Center. It looks like
No.
roughly 3 to 5.
Stride's probably about 7
7?
and a half
Right.
a day.
And it looked like around 1 mobile crisis
Mhm.
thing a day.
Maybe. I mean, again, with mobile at this point, I don't know. I would say it's about 1 shift, maybe for a couple shifts, but
Right.
yeah.
And how many do you expect to be able to handle when fully staffed?
Well, I mean, I would say at this point, we can, handle what we're getting. I think the issue is again, not a lot of people know about it. And so it's more about utilization than anything else. But we've got and again, I wasn't able to really talk a whole lot about some of the other services, but we've got a pretty deep bench. And part of that is sometimes you may not be able to deploy a person or two people face to face. If we only have one person who's staffed and maybe it's at the hospital, they need a person, or law enforcement might be there, we may say we're just going to deploy one person, and we may have to do some of those kinds of things, just sort of spread it out too, depending on volume. If you have somebody in Lawrence County and somebody else is here, you may have a manager. So, we're trying to do everything that we can. And what I've found with Stride is, even when, people are like, well, what's the max? Like, you really just don't want to set one, because if a person's in crisis, you don't want to turn them away. And that's kind of where I'm saying, like, we go up, in terms of leadership to say, if you've got somebody you can't handle, you need to give me a call. Like, we really need to make sure we have enough people. And then that's when we really come back and say, yeah, what does our staffing need to be? Because it's just like what you're talking about with the data. You really need data to, kind of see the need, but you also have to make sure that people know the resources are there and available. So I think we're kind of doing that fine dance at this point. Thanks.
Thank you. All right. Still not seeing any takers here in Zoom, so I'll go back to here. Looks like Sam Holderman. Hello.
Hi.
Hi.
My name is Sam Holden. And first of all, I wanted to say I really liked your presentation today, especially the focus on those implicit structural barriers and just sort of the basic quality of life type of things, because I think that's what diversion is. And I think that's where we need to focus more of our attention and energy as a county. So I appreciated that. Especially because I feel like a lot of the times when people do talk about diversion, things like community corrections come up, or problem solving courts or probation and things like this. And those are part of the criminal legal system. I don't think those are part of diversion. Like, we can have conversations about those things, but if you are like investing your resources in diversion, it would not be those things. And then I just also wanted to kind of add on to what a lot of the previous people said in terms of this contradiction between, being invested as a county in diversion and reducing the jail population, and simultaneously wanting to build a bigger jail. Like, I don't see how those two things can go together. Because you need to kind of, it feels to me like doing that feels like you don't have faith in your diversion effort, right? You're like, we're going to build a bigger jail because, like, I don't know. And I also just, like, I would think, we've heard housing like so much, like, what could you do housing wise with $80 million, right? And if that's all you did as a county council was like make housing more accessible, like, that would be amazing. Y'all would be like the greatest county council. But instead there's like all this focus on a brick and mortar, facility, a new jail, which is going to be, larger and extremely expensive. And you're still going to have, it goes back to the roots, right? You're still going to have all of those root issues in place. So I know y'all are just two of the county council, and like this, the 400 number maybe didn't come from y'all. Maybe that was like a broader county council thing, but that does feel to me like, I don't know, it feels contradictory. Thank you.
Thank you. All right. Still just checking and make sure we're balancing it out. And I don't see anybody, but we have another sign up, and it's the last one on the list. Lee.
Hi, my name's Lee Grundhofer. I'm a citizen of Monroe County since 1993. I wanted to talk about local income tax.
I'm sorry, do you mind?
Okay.
Yeah.
I wanted to talk about local income tax because that's where the money for the new jail is going to come from. Based on the 2018 legislation that allows for such things. But what we're asking for when we talk about diversion is just basic quality of life, housing, healthcare. We should not have to be diversion. They should be the norm. Diversion is not enabling of access. It's a removal of barriers. We had to set up the jail. We had to set up the police. Incarceration is not inevitable thing that we have to divert people from. And I want to go back to your slides, which talk about the root of the problem. And it seems to be housing. Housing seems to be what we've been talking about over and over. As more people experience over 20% increases in property tax, the county fiscal property should be helping homeowners and community members experiencing homelessness. Homeowners provide 53% of the property tax budget. We should use the windfall of property tax increases to create sustainable and equitable support for those who need it, and we all need it. The sentencing realignment enacted by the state in 2014 was an attempt to get counties to create treatment resources through programs like Recovery Works. Instead, it filled the prisons, and then with the 2016 changes preventing the transfer of some people in jail to prison after sentencing led to overcrowding issues around the state. Though in Monroe County, our jail has not been overcrowded for some time. Now, this 2018 legislation allows us to build new county jails using the HEA 1263 jail local income tax. This is the road of hacking at the leaves and not pulling the roots. We need to stop policing and to start thinking about building alternatives. And I had a couple questions. Was what do you do with the kids with Stride Mobile, which was answered. But there is a special local income tax for juvenile diversion already. And so what's being done with those funds and how can we use those? I just want to say that I sent email to people in the mail domain co.monroein.s and it bounced back. And I called the help desk and they said it was broken. So I want to know if email to you works. Thank you.
Yeah. Email to us should definitely work.
Yeah, because I haven't received.
Yeah. Let's connect after to make sure you've got the right email address.
All right. And last call via Zoom. No, I don't see any. Okay, well, that concludes our public comment. So thank you all so much for all the public comments here that we had. And then the last part of our business is the approval of summary minutes for July 3rd, 2023 and July 10th of 2023. I know I had noticed somebody's name was misspelled incorrectly on one of the minutes. And I know Ms. Mosier is going to work to correct those. But if I can have a motion to approve.
Move to approve the summary minutes for July 3rd and July 10th, 2023 with any scrivener's errors corrected.
All right, now second, and since there's two of us, all those in favor say aye.
Aye.
Okay, all right. Our next meeting we will have is back here Monday, August 7th. So it will be at 4:30 and I will be chairing again. Yay, yay for everybody. And without further ado, this meeting is adjourned. Thank you.